Is running out for TriHealth and UnitedHealthcare to strike a deal. Without an agreement by midnight tomorrow, thousands of tri-state patients could lose in-network coverage. Consumer reporter Taylor Nimmo joins us live in the control room with where things stand right now. Taylor?
Yeah, Valerie, we're now less than 48 hours from the deadline, and there's still no agreement. A TriHealth spokesperson tells me they're still hopeful a deal can be reached before tomorrow. So here's a clear breakdown of what we know so far and what could change starting January 1st.
This is TriHealth calling with an important update about our negotiation with UnitedHealthcare.
Calls, texts, and letters all warning UnitedHealthcare is expected to be out of network with TriHealth after December 31st.
My gut feels sick. It makes me feel afraid. Being one of the people who's living on a fixed income right now.
I certainly don't want to change. I think I've had excellent health care through TriHealth.
But come 2026, some patients may have no choice.
I don't like surprises. I need to know how it's going to fit in with my income.
Deborah Kovacs-Sturdivant says this feels like a corporate fight with patients caught in the middle.
And it infuriates me because I feel like UnitedHealthcare subscribers are being used as pawns in this.
Last month, I sat down with TriHealth's Dr. Raymond Metzger.
I understand the frustration of patients feeling like they're in the middle.
Here's the standoff. TriHealth says United isn't paying fairly compared to other local systems and is denying claims. United pushes back, saying TriHealth is demanding a 35% rate increase that would drive up costs.
Their actions over the course of our discussions have consistently jeopardized their members' access to TriHealth.
TriHealth says they're still pushing for a deal, but with time running out, they're urging patients to prepare now. The question we keep hearing, will I lose coverage? Original Medicare with a Medigap plan is not impacted by this. This does impact UnitedHealthcare employer plans and Medicare Advantage members.
It's going to create an immediate problem in the industry locally because I'm not going to be the only one who's going to look to jump ship. Everybody is.
In a statement, UnitedHealthcare said TriHealth continues to demand significant price hikes, the majority of which would come out of the budgets of local employers. TriHealth is urging patients in active treatment to apply for continuity of care by calling the number on the back of your insurance card. Now, we're continuing to press both sides for answers, and over on WCPO.com, I've put together exactly what you need to do right now to protect your care so you don't waste your money.